Hi, this is Dr. Cox with an update from Alpine Pediatrics. We've been getting a lot of questions recently about antibody testing, and you've likely been hearing a lot about this in the news as well. There have been a few cities that have contracted with a private company to do antibody testing in some communities around us. And I wanted to talk to you a little bit about antibody testing and why we currently at Alpine Pediatrics aren't ordering antibody testing. And there's a couple of reasons, but essentially it's not really very helpful right now. And I'm going to explain to you exactly why that is. So for any test, we're prone to false positives or false negatives with any test that's out there. And that's the case also for antibody testing. I've got here just an example of if we had 100 individuals who were tested for antibodies to COVID-19. So these X's, each of them represent an individual person. So with the current test that we have for COVID-19, the current antibody test, they carry about a 5% false positive rate, meaning that if you tested 100 people, even 100 people who didn't have the disease, we would find that of those 100 people, about 5 of them would test positive for that disease, even though they didn't really have it, meaning that if we tested 100 people, we're going to have 5 that test positive for COVID-19 antibodies, even though they've never contracted COVID-19 in the past. We're going to get back to that in a second, but currently in the state of Utah, we've had about 8,000 confirmed cases of COVID-19. Now we know that those cases don't represent all cases of COVID-19 in the state of Utah, but let's just say for this example purposes that for every positive case, every person that's tested positive in the state of Utah, let's just say that there's 20 other people that had the disease that were never tested at the time, but actually had the disease. So if that was the case, then we would have closer to 160,000 people in the state of Utah who are positive or have had COVID-19 in the past. Now that sounds like quite a few people, 160,000, but when you compare that with the state of Utah population at 3 million, that really only represents about 5% of the population. Now, most people, including myself, think that ratio of 20 to 1 is likely very elevated. It's likely somewhere well below that. But again, for the sake of the example, let's just say the prevalence, that's what this number is, the prevalence, 5%. Let's pretend the prevalence is 5% in the state of Utah. So if that was the case, if we took 100 people in Utah right now and tested them for COVID-19 antibodies, that would mean that 5 of those 100 would test positive. These are true positives, people that truly had antibodies that are now testing positive for those antibodies. So I want to introduce a term, a statistical term called positive predictive value. And that term, essentially it just means the percent of those who test positive who truly have COVID-19 antibodies. So if you take an antibody test currently, what's the chances that you truly do, and if you are positive, what's the chances that you truly do have antibodies to COVID-19? So with a prevalence of 5%, with the current testing that's available, that is going to be, that positive predictive value is 5 in 10. So you've got a 5 in 10 chance. Again, these are false positives. So you've got a 5 in 10 chance that if you have a positive test, like any of these 10 individuals, you've got a 5 in 10 chance that you truly do have antibodies to COVID-19. So that's about 50%. So right now, the positive predictive value for antibody testing in the state of Utah is going to be about 50%. Now, if the prevalence is lower than 5%, then that number goes down. Conversely, if the prevalence in Utah goes up, so say at a future date, 25% of the population now has been infected and is recovered from that virus. So if we have 25% of the population now that is true positives, then the positive predictive value is actually going to be closer to around 85% or so. So that number goes up as the prevalence goes up. So that's the first main reason why we're not doing antibody testing at Alpine Pediatrics, and we wouldn't really recommend it right now, is because there's too high of a rate of false positives. Now in the future, we may consider doing antibody testing once the prevalence of the disease has increased, but at this point, there's two questions then if you do go get a test for antibodies right now. There's two main questions that you have. The first is, am I truly positive? Did I really actually have COVID-19 infection? And currently that chance is 50% if you have a positive test. Now, the second issue is if you are a true positive, if you really had COVID-19 in the past and you test positive for antibodies, what does that mean? Does it mean that you are immune to further infections, that you can't get sick with that virus again? We don't really know the answer to that question. And until we have the studies to actually show us the answer to that question, antibody testing really isn't all that helpful. So if you're considering doing that right now, just ask yourself that question. What will it profit me to know if I do test positive? One, it's possible that it could be a false positive. And then two, if it is positive, does it mean that I'm immune for further illness? So again, keep that in mind right now. Now, know that the state of Utah is actually currently engaged in doing antibody testing on a larger group of the population. This is a representative group of the population that is going to actually help us to understand what this number is, what the prevalence is in Utah to this point, what percentage of Utahns have already contracted COVID-19. And we'll likely have the results of that testing in the next month or two, so stay tuned for that. But on the individual level, really wouldn't recommend antibody testing at this point. One question that I'm also getting a lot in clinic is, are you seeing a lot of COVID-19? And the answer to that is really not a lot. So we have at Alpine Pediatrics one clinic that's our sick clinic that all of our sick patients go to. So any patient with cough or fever is sent to our sick clinic. Now that has been our Orem clinic, but that was changed 2 weeks ago. And now our sick clinic is our Traverse Mountain clinic. But between those two clinics, we've tested 200 or over 200 children for COVID-19, and only 3 of those have come up positive, meaning that less than 2% of those that we've tested have been positive for COVID-19. So I hope that helps you to get kind of a sense that we just really haven't seen a lot of this disease in children yet to this point, but stay tuned on that. We'll continue to keep you informed with future updates, and feel free to visit our website as well for any other frequently asked questions. Thank you.